first, let me just thank you for taking the time out of your busy schedule to do this for everybody. All seriousness aside, or kidding aside, we really appreciate everything that you're doing. We know that you probably have a lot of sleepless nights dealing with the decisions that you have to make on behalf of everybody in the community, and we thank you.
Well, no, thank you. It's been a team effort, starting with really my staff, and we've been a little bit shorthanded in my office. And as y'all know, Stacy Marquardt, Kathy Perry is my probate auditor, which there's essential services that the county has that has to be continued, which we're doing that, but we've really become more of a command center of just the activity, because this changes by the hour. And the thing that's unique about this is that we will turn in something. Number one, we don't have a health department in Parker County, so that's a little bit different of a situation than, say, Tarrant County, who can be very responsive very quickly. So what we do is have by appointment of the Commissioners Court, that we have a physician that's the liaison to the state health department. And so what we do is work through which is Dr. Welsh, and so we work with him virtually on an hourly basis and trying to get information, because the challenge with this is getting information out of the Texas Health Department, which also does, they're for all the 254 counties in the state. And so it's trying to get information quickly. The information, one thing is for sure, the information we get from the Texas Health Department is accurate, but it is a challenge. And so one of the things that we're trying to do, and I'll just step back and kind of go back from ground zero of this thing has continued to evolve, and to the point, I think we all know that the governor up to this point has given, for the most part, really local control to the counties, and for us to initiate those. And it's a bit unique, because if you look across North Texas, density is really the key issue here with regard to the counties. You got Collin County, you got Dallas County, which obviously is experiencing different numbers. You got Tarrant County, who's experiencing even significantly different numbers than what we have. And so one of the things that has helped us a whole lot is being rural. And what I mean by that is just our ability to spread out just a little bit more. We're already spread out somewhat, even with 140,000 people throughout 19 cities and 910 square miles. It's a different situation for us than it obviously is for Dallas County, who's brought in the State Guard to do some things and we're not near that. And one of the things that I want to clarify is that the governor, I'll go over the governor's executive order, which really basically, it really copies what we have in place. So there's no change here to us, basically with what the Commissioner's Court action was. He adopted exactly, really virtually everything that we have. So life goes on just like you know it. One of the things that is a bit confusing to some people is the shelter in place. And why we're not going to that, there was a reason why the governor did not mandate that. I know that Dallas County has been very big with that, with the county judge, Clay Jenkins, has really pushed that. Tarrant County recently did that, only in that the mayors have been supportive of that. We are also working with the mayors of Parker County, and we have a conference call this Friday to look at doing that. But basically, we're already at a shelter in place. And one of the things that's confusing, when I get comments all the time that, you'll drive by and you'll see a Home Depot or you'll see a Lowe's with the parking lot packed. The shelter in place does not change that. It does not impact that whatsoever. I know that Abilene did pass a ordinance change which limits to the fire code 50% occupancy. I think that's something that we're going to be talking about this Friday, because it is frustrating when you go into a Home Depot, or if you go into certain grocery stores and there's a whole lot of people there and the spacing becomes a challenge. That's more of a city issue. Now, we can mandate that in the countywide, but I would rather the respective cities look at doing that. We're going to have a discussion whether we do that as a county or not. But basically, right now, today, we have actively 3 active cases, with 1 going off the books, which went back as a recovered, and we noted that yesterday. So basically what we have right now, we've had 4 total confirmed positive, which out of 140,000 people, and I know that first and foremost, putting people out of work is not something that it is something that we take lightly. And doing this, and I know the governor mandated this yesterday, and the one thing it did do is put a date to it. Now that we know it's up to April 30th, and then the return of all the school districts in Texas is now May 4th, which that, from the standpoint of that, that's good. We were close to that already with what the county was doing. The intent was to trying to get back to normal by April 22nd, and the numbers continue to stay low. And there's two pieces that I want to talk about. Number one, again, the rural part of that is one of the reasons why they're low. But if you go to Hood County and you go to some others, there's actually some of the counties, Johnson County, which is also somewhat rural and going out to West Texas, there is a spike of numbers out there. And I think it comes back to the number of tests that are being done. It's also been a concern of the community that there are people that are not being tested that has the virus. I think that is absolutely valid. We've stepped up the tests, trying to increase the number of tests that were being done here. And so what I've done, I met with Dr. Welch yesterday with also our emergency operations coordinator. And one of the things that I would like to do is, and I don't know if I could show this, one of the things we want to do is break this down and trying to get more information by test and how many tests are being done, how many tests are negative, and put that. And if you look at Tarrant County's website, you're going to see something similar to that. And so what we're trying to do is give the community, one, more information, but also it allows us to get more information to make decisions on, because the number of positive tests only gives us a part of the big picture. And so, how many number of tests we're getting, how many are testing negative. And so my focus is to increase the number of testing. Some counties across the state do have drive-up testing. We don't have that along with Parker County or Tarrant County. We haven't been given that opportunity. But I will tell you that we have been trying to be as transparent as possible. If we can get this done quickly, the next chart that you'll see is the cities broken down and the transmission type by city. How did they get it? And so whether in much of these, what we found is either some of these that have been traveling for business, they brought it back, which is about 47% of the people in Tarrant County. They leave Tarrant County, they go to work somewhere else, and they bring it back. And that's 47% of those numbers that they have, which I don't have the total number here. That's 73 of those. So really trying to get more information of this, how it's done, and then also challenging and tasking our emergency operations to do a tracing analysis with these individuals. Who do they talk to? What is the list of, what's the exposure to the community? Because what we're trying to do, even with these numbers low, I still believe and agree with some of the comments that I've seen on social media that there are people out there that are walking with this that may not meet the criteria to be tested. So first and foremost, don't let the numbers allow you to drop your guard as a community. And I think one of the reasons why the governor did what he did yesterday was each county throughout the state, it has their own, whether it's going to, whether it's a different, shelter in place, or whether it's somebody easing restrictions. I know the legislature has been pushing to try to get the economy going again. And I'll be very straight up with you that that's why cities and the county have reserved funds that to get you through emergency situations just like this. Is it going to impact us financially? Absolutely. But when it comes to the safety and health of our community, then I think, hold on one second. Hey, Stacy, can y'all close that door for me? Just any outside noise, just to make sure. Is the safety and health of our people. So anything other than that, it's a distant second to that. And so we're going to make decisions based on what's the health and safety of our community, regardless of the financial impact that we have. And so, again, that's why I believe that municipalities and the county has reserve funds to get us through situations like this. And so I can go through a whole lot of other things, but I just wanted to update you with, one, what we're doing. Again, one of the objectives, the next thing we want to try to do is extend or add to our declaration to get more specific on the number of tests that we're doing, to get more of accurate data as to, are these numbers low because we're not testing people, Are they low because what we're doing is working? Is it a combination of both? And so, again, I think we need a reek of transparency because it's critical that the people of Parker County trust those that are in charge of this and trying to do the best thing they can without perceptions of whether they're hiding anything or they're trying to keep people calm and keeping information hidden. I want to be very clear with that what I know, I want you to know. And so there'll be a couple of charts coming out as we do that. I've tasked the emergency operations group to get that and get that quickly to me. And so, with that said, I'd open it up for questions and anything that you have for me.
Okay, Pat, the first question you may have already answered. How many in Parker County have actually been tested for COVID-19?
It goes back to what we're trying to do, Lisa, with trying to get the number of, get that number. I don't have that number. It has not been provided to us. How many, both privately or the ones that we know about that we've had some under observation of those that have come back out of the country that we're tracking through observation and through a self-quarantine. But as far as a number, it's exactly what you just asked me is what I'm trying to get that posted where you'll know how many that are tested and try to understand why that number is low right now, because I don't want to paint a positive or negative picture. This is just a fact statement that today we have 4 that have been tested positive, but there has been concerns and valid concerns about how many have been tested in Parker County. Is that why that number is low? The bottom line is if you're walking around with that virus, we need to know about it and have you quarantined to keep really to level the curve of this thing spreading. That's really the key to this, and trying to get more understanding of that is critical.
Okay, the next question that somebody submitted, why are we hearing of other cases of COVID-19 in Parker County and these are not being counted? Did that
Yeah, it's a good question. Again, it goes back to until it goes through the channel of approval through our liaison, the position that's the liaison to the the state health department. I get calls every day about, their neighbor told them that their husband's been tested and he's, all these things. Until I get that confirmed through the channel that came from the Texas Health Department, which is a law that requires them to notify them when a doctor tests somebody and they're positive and it comes back, that until I get that confirmation through our emergency operations coordinator that liaises with Dr. Welch, I can't document that as a valid test positive yet. But I do know, I will tell you this, and again, full transparency as we can. There will be more than 5, and that will probably be today. And so, again, it would just, is it good that we're at 4? Yes, it is. But I think we all agree here that we want to know who's going around with this virus and minimize the impact of that to our community. And, I look at these numbers and that's, it's as of now it's 4. Is that realistic to what's really out there? That's what we want to know.
Okay, thank you. The next question, does Parker County have enough PPE equipment, masks for law enforcement and firemen?
Yes. To answer all that, yes. We have had some disruptions in the PPE side of it. We've also worked with Senator Fallon on some of the supply lines and if we need those, but we've started getting supplies in. So that is now getting caught up with. But what concerns me is that we have had a disruption in that. So what we're trying to do is trying to get more supplies as a backup to ensure that there's not a disruption in the supply line and coming to us on the PPE side. But yes, we have had a little bit of an issue with that, and we think we've got it corrected.
Okay. The next question: what can the county Okay, let me just read it the way it's written. What can we county employees help with in the judge's office to lessen the load on his staff during this pandemic?
I think really at the end of the day, it really does come down to whatever we put in place. It really is it's the obligation, the personal responsibility of each and every one of us in this county to do the right thing, to practice good spacing, to make good decisions when you need to go to the grocery store. Do you really need to take your kids? Do you need both your husband to go? Does the whole family need to go? I think it really comes down to making good decisions, both from a personal, not personal hygiene, not like taking baths, but I mean, I think really just being very careful and sanitizing where you can. When you touch something that's been touched before by somebody else, continue to wash your hands. And we do know that this is a very easy transmission through those type of things. That has been confirmed. So just from a personal responsibility is to make good decisions individually that, you know, when you do have to leave and go to the store or whether you're going to work, to make sure that there's effective spacing and you're making good personal decisions, because at the end of the day, it's really all of us working together. There's really not much we can do here if some of our recommendations are not being followed and there's not good decisions that are being made by everyone.
Okay, so I guess that means that we probably will not be allowing churches to congregate again anytime soon.
There, and bear with me here. I've been coordinating with State Representative King's office on this, and we were talking last night very late. So one of the things in terms of the, bear with me here. There is some confusion on that, where the word exception comes in, implying that they're opening or easing that up. That is not the case at all. That the minimum requirement's still at 10 and still maintaining spacing when they're doing even video online. Trying to find this, and I'm now having a hard time trying to get this. Oh, here we go. The governor's office is looking into it further and confirmed that a little bit better of an explanation of what this executive order came out of. But apparently there's a statewide concern and frustration about that order and how you interpret the guidelines on the religious side with churches and congregations and meeting as a church. So as of right now, the intent really to be clear with this, we're trying to understand a little bit better, but basically at the end of the day, we don't feel it's any different than has happened. We'll get that confirmed as quickly as we can and get that out, but there is some vagueness to that. And once we have that confirmed through our state representative, and Judy, I see you on here. You obviously, you know, in talking with Ashley last night late and State Representative King, we need that response back fairly quickly, and I know they're on that. So once that's done, I'll get that out as quickly as possible. But we don't see any change in that.
Okay, what is the metric we need to be looking for to show we are turning the corner on this situation?
Could you repeat that? I'm trying to process. It's a good question. What is the metric?
What is the metric we need to be looking for to show we are turning the corner on this situation?
That's a good question. It comes back to what I've been pushing the EOC to give me is testing data and making sure, because the thing that really concerns me, and it should concern everyone, is if you're sick and you go to the doctor, but yet you don't quite meet the requirement for that, you could easily be walking out of there with the COVID-19 virus and then take that and then start spreading that thing. That's an easy one. It's going to be the increased test, the measurable, to know how many tests are we being given. And then you can start making good decisions as policy makers here locally. Now, the governor has done what he's done. That doesn't mean we can't take extra steps like what, again, in talking to the city of Weatherford about, would they be willing to look at a capacity issue and a change in their ordinance to go on a 50% capacity to their fire code. That's one of the things we can do. But at the end of the day, we need to know how many tests are being given, and then make decisions based on that, because until that starts going out widespread, and even to those that whether it comes back to the doctor and he says, you know, you don't quite meet the criteria for the test, I'm not satisfied with that. We need to open the doors up a little bit more on the testing and make sure that if we have to test anybody that walks in, what I would like to do is have what similar other counties have had, is a drive-up test to where we can get those, and then we'll have better accurate numbers. But right now, that metric is going to be the number of tests that we're giving and opening that up a little bit better.
Okay, and if anybody else has any questions, if you scroll, if you move your cursor down at the bottom, you'll see a little chat box. You can click on that chat box and you can type in your question and we can see it, and then he can answer any more questions that y'all may have. Pat, there's one more question that came across. What are the signs we are starting a recovery?
What are the signs of recovery?
Yeah, yes.
Well, that's kind of that's a challenging question for a county judge to answer. I think, you know, the medical physicians and those that basically we had, like, you know, ironically, we had the first case was a justice of the peace judge, works for the county. You know, he was very prompt in getting tested and going to the doctor. What I think some of the initial signs were, I think we all know what those are. We've seen those enough. But being quarantined and then starting to lose some of those symptoms, you know, and even for him, I believe he's coming back to work today after a rigorous process with this. Basically not exhibiting any more symptoms at all is for that to be returned, and he has now been designated as a recovered case. And so the doctor's note was very clear that he's done with this virus. It's not testing positive. And so, you know, I think that, well, again, I'm not a doctor, but my thought on that would be is that after you have been cleared from the doctor and then don't exhibit any more symptoms at all, at that point, then we can start going back into your normal life again after you've been quarantined and verifying that those symptoms are gone. It's a good question. I'm not a medical doctor. It's the best I can give you on that one.
Okay, so we have some more questions that have come through. Are children going to be tested prior to going back to school?
Are children going to be tested prior? So I take it that question means that there's been some kids that have been either sick or exhibit symptoms. I'll take that let me just take that as an assumption that if that's the case, then we would ask for the parents to have responsibility to ensure that before they integrate those kids back into school, if they have gone to see a doctor to make sure and hopefully given a test for that. But kids are not going to be tested before they go back to school. No, unless there's symptoms being given, they meet the criteria for the test of right now today, then they would be tested.
Okay. Next question. Is it true that if a person from Parker County goes to Tarrant County to be tested, that the patient's results are counted in Tarrant County numbers?
I understand that if you live in Parker County, even though if you're tested in Tarrant, that number will be a number that we track here locally in Parker County.
Okay, so let's see. Back to testing on Monday, Tarrant County announced they would begin to report provisional case counts to provide more information to the public. Does Parker County have any such plans?
You broke up. There was a disconnect here. I'm sorry, can you repeat that?
Sure. So on Monday, Tarrant County announced they would begin to report provisional case counts to provide more information to the public. Does Parker County have any such plans?
We do, and it comes back to, and I wish I could, this is a chart here that I'm sure, I'm probably can't see it too much. This is that chart you're referring to. And so my intent is that we get this completed as quickly as possible. You'll see it on the county website. You'll see it on my Facebook page, both personal and for the county judge page. But that's exactly what we were talking about earlier. And it comes back to the testing criteria, breaking that down to the transmission type and give it as much information as we can. I will stop at nothing for that to be done and done quickly.
Okay, how can we be praying for you, your family, and other leaders in our community?
Well, I appreciate that because, and I've had several pastors that have called and done that. It has gotten better. I think there was initial rumor that we're taking steps within the county. We have a county continuity plan where essentially we've shut down a majority of what the county's operations are. If you go in the annex, you can go to the clerk's office, but controlled access with a deputy to ensure one goes in at a time. So we're doing everything we can to maintain a continuity of those essential operations of the county. This office is still open, but those people around, and even when it came out of the gate with when they announced that there was a judge, Parker County judge, that was tested positive, they failed to put A. And so what it listed, I think, was the Parker County judge was tested positive. And I think we're getting calls, and I think Kathy's in this thing somewhere. I don't see the little face here, but my wife Kathy is on this line, and she can attest to the calls that have come in, and it's a lot of hours but I really want to just really talk about the staff and what they're doing. There is a lot of, the county has taken the responsibility, as we should, to be the hub of activity with what's in coordinating and collaborating with the municipalities. I will say this, that the decisions I make are not made myself, but in collaboration with each and every mayor. And every one of those, we're in constant contact with each other. Also staying in touch with the county judges throughout the region, both in North Texas and also here in the local rural areas. Judge Clark in Wise County has been great to work with, among the others. But I think to continue down the path, I think continue those prayers for the staff and for the workers of Parker County to do. We're all in it together. I see Deidre here, works in the Sheriff's Department. So they're probably, while we all go to bed, they have to continue to go to work and work through the night, continue those jobs. And so I would ask for those prayers for those that are out there that have to do those jobs day and night. And we appreciate that very much.
Thank you. Have you already answered where are the tests being given? Because I know hospitals and doctors' offices. Can you be specific on where the COVID-19 tests are being given right now in Parker County?
We're getting an update on that, but as I know, is the hospital district, the hospital itself. I did understand that LabCorp was giving them in Quest. That may be changing a little bit. I do want to get more of a thorough understanding of where those tests are being done, but they are being done in Parker County. I don't have a thorough list of that, but I do know that the hospital is giving tests, and also the hospital district are being tested as well. Initially, there was some confusion when that came out that we were sending them to Arlington because we weren't set up for that yet, and the swabs were, of all places, were manufactured in Italy. So that's why there was such a shortage of those test kits to do this. Now we have manufacturers of those swabs that are made in the United States. So that's opened that up quite a bit, but to get an exact who is giving those tests, we're still working on that and getting that update, but I do know the hospital district are.
Okay, another question. We heard that Tarrant County is finding people that are traveling and not an essential business in Tarrant County. Is this true? Do we need a letter from our essential businesses to travel into Tarrant County?
You do. And it's a good question. I'm glad you brought that up, because the confusion part about this is that Tarrant County has designated themselves, is different than what Parker County is. You can come into Parker County. We don't need that. And so whether you're coming from Hood County or whether you're going into Hood County, now if you're going into Hood County and they have it, as they understand, then your employer will need to give you that. I would say this, that if you're going into Tarrant County, I think you should give, there should be a letter given to you to allow that passage into another county. They're not going to pull you over unless you're breaking the law. I don't think it's that big of a deal. And if you don't have a letter and they pull you over and you're telling them where you're going, they're going to probably tell you, and this is from Judge Whitley, that they'll just give you a warning to just tell you, if you're going to be doing that travel, we ask that you have that letter, but please have it with you the next time you go. But in Parker County, again, we don't and have not been and had that designation to where you do that. And one, we don't want to, I don't think you need more government in your life. I think what we need is people being personally responsible. Where are you going to go anyway? The non-essential businesses are closed. And so I think for the most part, the people of Parker County entrust them to make good decisions and take personal responsibilities we talked about. And if you got to go to work, go to work. And if you need groceries, go get groceries. If you have something wrong and you need repairs, then Home Depot is going to meet that need. But people just limit your travel to the areas that you need to go to live your life, and we'll get through this. It is a disruption, but we will make it through this and be fine.
Okay, the next question. Will we reach a point where we are limiting the number of people who can enter into a business?
I mentioned a little bit of that before in terms of collaborating with these mayors on changing. For us, we can't, we're not the same as a city. We don't have an ordinance ability. But for example, say Weatherford could pass an ordinance that would limit, say, a certain percentage of, say, 50% occupancy. We can do that also as a county, and not do an ordinance change, but do a mandate. Both, we would have to designate that through those in the outlying areas in the ETJ, and those that are in actually the city limits of the cities would just have to designate that to be consistent. But I am supportive of that, to limit just by observation and just randomly going into Home Depot or Lowe's. They're doing the best they can, but still, when you look at the parking lots, I mean, that's pretty obvious that there's a whole lot of people in there. Is it in capacity? Again, if we're going to do everything we're doing, and the governor did what he did yesterday, I think we still have the obligation to continue to look at this and really let's not let our guard up yet. I mean, let's pray that we can maintain low numbers, and as we get these tests back, even increasing those tests. Maintain low numbers and keeping this, what we've been doing has been successful. And so from that standpoint, if you're going to do this and the governor's going to do what he did, let's continue to look at next steps and making sure that we're going to take that spacing obligation all the way into, if you're going into a Home Depot, you're not going to be shoulder to shoulder with somebody that's in there as well. I think that's an obligation of us to look at that. So yes, I'm very supportive of that.
Okay, I think the Parker County Sheriff's Department needs more PPE masks. Where do they go to get those? Collaborate
with our emergency operations team to get that. We're getting those supplies in, as I understand it, and that would be Sean Hughes. And so, Deidre, you're on here. If that's the case, and I'll be talking to Sheriff Fowler as well on this. So yeah, if there is a need for that, then we can certainly make sure that they get those. Because initially, just as this was unfolding, I think we got so many, and I think everybody wanted them, whether through the county, whether through the Sheriff's Department, so we had to divvy those up. We should have that. We should be well beyond that now to give them what they need.
Okay, the next question. Are there guidelines for when a person who has recovered can come out of quarantine if other members of the household are still sick?
If there are other household members that are sick, with one coming out of quarantine?
Correct.
That's a good, okay, let me think about what you just said. So we have one individual that come out of quarantine that is now recovered and back to work. And so the family, are you saying, has been exposed and are in quarantine, correct?
The question reads, if other members of the household are still sick.
Okay, you're saying sick.
Mm-hmm.
Okay, that would be under the doctor's care of what and how to set that parameter of how they're going to, whether they're going to be separate or whether they're going to be, they need to be separated on a separate quarantine, or whether the one that has now recovered and gone back to work would be isolated from them or not. That's again a physician question. I'll tell you what, I'll get with Dr. Welch on that one. That's one of those that I'm not sure on how that would be handled. That's a medical question of how the doctor would recommend that would be covered within that particular home or that particular situation.
Okay. If you know of a gathering of more than 10 attendants, should that be reported, and to whom would we report that to?
Absolutely be reported. And in fact, there's several businesses are non-essential that, whether it's a hair supply or I'm sorry, a hairstylist or a Hobby Lobby or whoever, We got reports of those that were opening, which we stopped. We can't do that and ensure that these things are being enforced, because we're going to have some situations where they're just going to defy us, and they continue to do that. And there are those businesses out there that we do send our emergency operations in there along with law enforcement. We're taking that very seriously. Absolutely, we need to know about it. And that would be through my office or through the emergency operations, again, which is through my office. You can also go to the sheriff's department, but they're going to revert that back to us. But I would say through my office.
Okay. Another question came across: will any steps be taken if retailers are selling, I'm assuming they're talking about the mask, to the public when our first responders still do not have adequate supply? So
well, first of all, I would say that let's just minimize that situation to make sure our first responders have the supplies. But in the case that they don't, and you have retailers selling these things, that has gotten brought up recently by a particular retailer. And bottom line is our first responders are going to have those masks. If we have to go to the retailer and buy them, we'll do what we have to do. But let's just clear that up right up front, that we just make sure that our first responders are not out of the equipment they need.
Okay. Here's another question. When the time arises, I predict that various groups will want to step up and help. Is there a go-to that can help coordinate these groups?
That would be my office, and it goes back to my staff. I've been working very closely with the Church Alliance, through the Baptist Association here, and also the independent school districts, because I don't know if, and you may be aware that a lot of the school districts in multiple locations of their schools have given out, I think, over 11,000 meals to date. We're working with the Church Alliance in terms of the proximity of where each churches are to set up a meal program for those to ensure their families are taken care of. And so we're kind of the hub of that. We've also gotten feedback from several of those out there that have the capability to really help from a financial basis. So we're trying to collaborate that together where those needs are. One of the things that's frustrating for me is it's hard to help those that are out of work. And this stressed a lot of people out of work that are maybe single parents and those that just are on a limited income that live paycheck to paycheck that we threw out of work. And it's a very frustrating situation. But I would say that would come through my office. Again, this is, we have a lot of things that, transportation projects continuing. We're in the process on some economic development things that we're forced to do. But again, the bottom line is 95% of everything we're doing in this office right now is related to this virus and reacting to it and being in a ready mode. And so I would say this office would be the one to where that hub of activity would be.
Okay. We just had another question come through. We can limit guests to businesses individually as well. Walmart has asked that visitors come one person, one cart, leave family members and kids at home. I guess that's an answer to a question. So have you heard of any businesses that are violating, I guess they have to allow half of their occupancy in their establishments. Is that correct?
Half of their occupancy?
Like if they're allowed 500 occupancy, then they can only have 250 occupancy? If
we pass that change in ordinance, yes. As of right now, that has not changed. If you're a grocery store, there's nothing limiting you or restricting you of how many people go into your business. Or a Home Depot. We have not taken that action yet, which we're looking at.
Okay. Are there any other questions that anybody has while we have Judge Deen on the line? I do want to let everybody know that to be sure and visit the East Parker County Chamber website. We have a resource page there on health updates, COVID-19 updates, SBA loans for our small businesses. I know that's really big right now. And then a list of our restaurants that are still open and serving. I do have one more question. Can first responders wear masks made from fabric?
Wow, okay.
So I guess this is an individual that is making masks, but they're from fabric. And the first responders wear those.
That's a hard question because, one, I don't know the design of it, who makes it, does it meet certain criteria? That's, well, first I commend them for making the attempt to do so and trying to, there's a lot of that going on. We have a pharmacy across the street on the square that has begun making antiseptics and those things and sterilizers. I can't answer that without looking at it and then letting the professionals with our EOC look at it and get a validation that's going to be effective or not. I just simply don't know. And, we do have some very good masks that we are giving out. I know there's like 3 different styles of, and so what we try to do is give the very best that we can out to those. And in fact, I tried to use one when I magistrated at the jail Tuesday. I couldn't figure out how to get the thing on, but I've never used one, but I know that there are those that we really insist on using to make sure that it's filtered and to make sure that they're getting the best, protection that they can. I just can't answer that in terms of fabric. I don't know what type of fabric. I don't know what the design is. That has to be qualified through somebody that would know, either through our emergency operations people that would know more about that.
Okay, I have another question that's similar to one that's already been asked, but can you tell everybody again who they need to call if their neighbor is throwing a party with more than 10 people? Who is that they need to call again?
It would be my office, and if to say that this is after hours, it would be either through it, and I've made my cell phone available on that, but really more our emergency operations team that does that. Sean Hughes is going to be the one that's working together with law enforcement on some of these violations that we're hearing. Again, I want to kind of temper this a little bit with if you have people that, yes, we want spacing, we want minimum 10 people in a situation where there's a grouping or whether there's an event going on, but I don't want this to be such a mass panic here that we have some people coming over and the neighbors running over and counting. Is that 9 or 10 or is that 11? I think one thing that we need to be careful of here is being calm, and let's just work together a little bit. If you see where it's an excessive, where there's a whole lot of cars parked out in front of a house, and I mean you're talking about a significant number of people, and there's a spacing concern that someone has, and let's act on that. But if what I don't want is to overreact and have a community that is so uptight and sensitive. One of the things we haven't talked about is obviously the medical part of this and the fear of getting the virus, but is our ability to control this mentally in ourselves and our emotions. And so I would hope that when you see something like that, yes, if it's a clear violation, let's act on it. But if it's somewhere where you see 6, 7 cars and all of a sudden we have pandemonium and we're calling and overwhelming our law enforcement, our emergency operations where they could be doing other things. Let's just use good judgment with that and not overreact and say, oh my God, there's 7 cars out there and they've got, 6 or 7 people there. And, I just want to be sure that we're making good decisions. But the most important thing is we stay calm through this, just that we're doing everything we can without overreacting and overloading our law enforcement and overloading our emergency operations. Short question to a long answer. Sorry about that.
Well, thank you. I don't have any more questions that have been submitted. So if there are no more questions, Pat, we just want to thank you, or I guess I need to address you as judge. Thank you. Thank you for taking the time. I do have one more question that just popped up. What is the current plan for opening up all of our local non-essential businesses? It's a very good question. When are you going to let the non-essential businesses go back to work? Although I do enjoy working out of my bedroom.
Well, it was my intent that we look at this get through this week and see where we are in the numbers, and really pressing our emergency operations to invalidate the tests that are being done, and start trying to ease back into this and getting some of these people back to work again has been a concern. But again, that's if the numbers dictate that, both tests, everything being factored in. With the governor's executive order that brought this in, took a little bit of control away from us, whether we can just override that and get the non-essentials back to work again. I'm not sure that, again, if the governor has that executive order in place, we're obligated to follow that. And so that runs it through the 30th. I will tell you this, when we did pass, I did sign a declaration for 7 days, which the Commissioners Court had to ratify that for 30, which they did, and was the right decision. I really didn't think that we were going to get to the 30 days, honestly. It was just in cases if this thing got out of control. The numbers started, again, prefacing this with where the tests are and that test data comes in. My intent is to start trying to ease back into this and get some of these people back to work again, at least on some of the non-essentials, yet while controlling, because the fear I had, and I talked to the school superintendents about this, and I see Sean on here, and I'm sure several others from the school district. Some of the biggest concerns, obviously, is having, you want to bring a child back that then infects 200 other kids. I think that's one of the biggest concerns we have. And so working with the school district superintendents has been really, really good, in working together cohesively with not one person, not myself, making these decisions. I mean, that's their call to do that. But I mean, working together collaboratively and making these decisions. But, for me, my intent was to try to get some of these people back to work, as these numbers dictated that. With the governor's order now, that kind of takes a little bit out of our hand, that we're looking at April 30th.
All right. Well, everybody is thanking you in the comment section. They appreciate you and your staff. The chamber appreciates you. So if there's anything that we can do for you or your staff, please let us know.
Thank you. And one of the things we want to try to do also is rather than these things get on, if you've seen Facebook, what I don't want to do is get into debates on Facebook. It just goes nowhere, and you get some interesting comments I'm sure most of you have seen. But what we'd like to do is we do two things. One, right now we're currently doing a conference call, three things. One, with the state legislators, with the governor's office, and then there's also with the county judges in the North Texas area. And then we have another with the mayors and myself, with the city managers. Those decisions are what we're doing. This is not a dictatorship. My voice is a cog in a wheel along with those mayors, that we make decisions together. What I'd like to try to do is do something again like this, and I would welcome this, doing it again. The most important thing is right now is to get information out and communicate, whether they can go across county lines and work. And so one, I think, easing some of the concerns out there. It's the first time that each and every one of you that have ever gone through anything like this in your life. And so there's a lot of fear, there's a lot of concern and uncertainty where we are. And my commitment to you is to continue to press, and it is somewhat challenging to do this, is to get these testing numbers and get those public, and to let you know, because it qualifies the number where we are. Because if we have 4 today and we're only testing like 2 a week, we're not doing a very good job here. So I think the one thing is to be just reek of transparency, and to make sure that you know what I know. I would like to have a conference call with the general public, and we can set that up. We would broadcast that out, Lisa, and coordinate that with the chambers. I think that's a great idea. I thank you for what you've done here. But again, I just want everybody, most importantly, is just to not panic, and to just keep a very, from a standpoint of the mental aspect of this, is to maintain a healthy mental approach to this, that you're in good hands, that we're doing everything we can, and we'll get through it. It's just a bump in the road is probably not the accurate best way to put it, because it's a very serious situation. But we are going to get through this, and if we stay calm and work together, make personal responsibilities really it doesn't work without that. And so it's all working together as a team. Then we're gonna get through this. Thank you for this opportunity to do that.
Yes, thank you, Pat. And I want to let everybody know that the East Parker County Chamber is doing weekly coffee talks Our next one will be next Wednesday, April 8th at 10 o'clock, and we will have the SBA do a PowerPoint presentation to explain the process of applying for these loans that are available to your business.
I think
So
that's
thank
important.
you.
Yeah.
Yeah.
That's
Thank you
great.
all very much, and we'll see you next Wednesday.
Thank you very much, Lisa. Thank you, everyone.